Our next speaker will be Dr. Matt Hurford. Dr. Hurford is the Chief Medical Officer of Community Behavioral Health here in Philadelphia. He will speak on some more local data, rates of benzodiazepine use, and medication-assisted treatment from CBH counties. Hurford.
Thanks very much, Dawn. Good morning, everyone. I'm the only thing standing between you and a coffee break and the bathroom, both of which might be very pressing needs. So I'm going to cut to the chase and do a spoiler alert. Despite all the differences that there may exist across the state of Pennsylvania, and all of the diversity in terms of race, ethnicity, age, Steelers, Eagles, Pirates, Phillies, there's remarkable concordance in terms of the rates of use of benzodiazepines and opiates among individuals receiving methadone treatment. I want to thank Dr. Schuster and the team at CCBH for providing us with data from a study they did from 2010. We actually, at CBH, replicated that data to see how it would compare. So our goal was to identify CBH members in Philadelphia who were in methadone treatment and concurrently prescribed both benzodiazepines, either benzodiazepines or opiates, or both. This was the period, the third quarter of 2010. We used paid methadone claims from all contracts for this analysis period, and we used the paid Medicaid pharmacy claims. I tried to find a map that was as old as this beautiful building. I succeeded by about 60 years, but this is from 1855. This building was built about 1908. But the College of Physicians itself is the oldest continually running trade organization in the country. It actually dates to 1787. So next time I'll have to find an even older map. Proud to say that we were able to get 100% of CBH data from 100% of CBH counties. That's maybe less impressive when you know that we are in fact only a one-county system. But I somehow feel a sort of numerical inadequacy when I see CCBH's master. We're this little nubbin. I'm not even sure, we may have fallen off the edge of the Pennsylvania map on that one. Like CCBH, we're a 501c3 corporation started by the city of Philadelphia about 17 years ago. We manage the behavioral health benefits for Philadelphia's almost 500,000 Medicaid beneficiaries. Similarly to CCBH, we serve roughly 100,000 members per year. Methodology slide is too long for a pre-coffee break talk, so let me just tell you, I'll let the data sort of speak for itself. We were able to replicate just about everything that the CCBH study did, except for the analysis of the physicians and specialties that they did. Unfortunately, our data warehouse wasn't able to capture that data. The first table I'm going to show you shows you just the general distribution of individuals in methadone treatment who received a concurrent benzodiazepine prescription or an opiate prescription by Philadelphia's zip code. I'm going to cut, and so you can just see we've got a lot of zip codes for a city geographically the size. For those of you who can't read it, I want you to pay attention. I'm going to read out this number right here, which is the average for the city system, 45.64. So 45.64, and I'm being very deliberate about the tenths and the hundredths because I'm going to show you something later in the presentation that's a little bit uncanny. I'm not usually quite such a stickler for statistical placeholders, but it is actually quite significant. So all this is to say that about 45%, or more precisely 45.64% of individuals unique individuals who received a methadone prescription for at least, or had claim for at least 10 days in the third quarter of 2010, also had a pharmacy claim for either a benzodiazepine or an opiate. All right, these are some general demographics just to show you what the population looks like that we studied. Here's the age distribution. See sort of a nice kind of bell curve feel to it. With the majority of folks being in the 35 to 50-year-old range. Our split, as you'll see later, was a little bit different by gender. majority of folks. Again, this is the population that was receiving concurrent benzo or opiate prescriptions and receiving at least 10 paid claims for methadone maintenance. Here's our racial distribution. And we're going to do a side-by-side comparison with CCBH in a moment. We wanted to make sure that our numbers weren't being disproportionately affected by certain providers. So these percentages on the right, we have de-identified providers going down the left side. We have the numbers, absolute numbers of the unique members in methadone maintenance who had a benzo or opiate prescription, and then the percentage of them per facility. So this is not the individual facilities rate. This was a sort of a check to make sure that we didn't have disproportionately high numbers coming from a couple of agencies. And I emboldened the agency E that had the highest percentage of folks and agency K that had the lowest. But all in all, not too dramatic a spread. So here's what we found. Of the 4,300 CBH members who received those 10 or more methadone claims, 31% had a pharmacy claim for a benzodiazepine. So some of the data that we heard earlier this morning discussed benzodiazepine use, and it captured some data around prescribed medical use of benzodiazepines and some non-medical use. So to be perfectly clear, this is for paid pharmacy claims, and therefore obviously it's not capturing illicit use or benzodiazepines that were paid, prescriptions that were paid for by cash. Our next table is going to show the distribution of members with a paid pharmacy claim for both. So again, this 1879 here, this is the total number of folks that had a concurrent prescription, and this is how it breaks down. 28% of them had a methadone with an opiate only, 42% a benzo only, 30% both. Of the 2,497 benzodiazepine prescriptions that were written for that population in the third quarter of 2010, this is what the spread looks like, with the modal benzodiazepine prescription being clonazepam. That percentage is higher than CCBH's, but clonazepam was also number one in their study as well, followed closely by Xanax. All right, so now this is where I think it gets kind of exciting when we look at the comparison with the CCBH data. So quickly, just some quick demographic stuff. You can take a look and see that the CBH population is slightly older in those categories, but not dramatically so. We did have a significant difference in the gender ratio, 57% in women in CCBH, 41% in women in CBH in Philadelphia. This is our racial difference, and this would be consistent with the with racial demographics across the state, with a higher concentration of African Americans living in Philadelphia, and is reflected in the percentages here. So here we are. I ran this several times, and thanks to Dr. Rebecca Robert in our CQI department, now you can understand why I included the decimal points. It's sort of uncanny, but of the, we're talking several thousand individuals with 10-day methadone claims in Philadelphia and in a very diverse, geographically diverse landscape across the state of Pennsylvania. It really comes down to 0.2% difference in the number who have a concurrent benzodiazepine and opiate prescription, and less than, or almost exactly, 3% difference for those who have a concurrent benzo-only prescription. My take-home message from this is that I need to play exactly the same lottery numbers that Dr. Schuster does. Because when he wins, I'm going to win big. No, in all seriousness, he and I have been working for years to get these numbers perfectly aligned. We have a little more work to do, but we're almost there. We're just going to, a few more, we'll tweak it. All right. So further comparison, again, to break down in both organizations, we've gone from the universe of everyone that had a methadone claim for 10 days to just those that had a concurrent benzo or opiate prescription. look at this concordance. So this is the breakdown of what percentage of those folks either received an opiate, a benzo, or both. Identical, 28% receiving an opiate along with methadone. And you can do the math, but 50 plus 22 is 72, and 42 plus 30 is obviously 72. Fortunately, everything adds up to 100, but remarkably similar rates there in terms of the breakdown in terms of the opiate use. So, in summary, opiate and benzodiazepine prescriptions are highly prevalent among the methadone population in Pennsylvania. Data from Pennsylvania's two largest Medicaid behavioral health managed care organizations demonstrates that somewhere between 30 and 33% of individuals receiving at least 10 days worth of methadone claims are also receiving a prescription that is being filled and paid for benzodiazepines. And that the prescription rates really appear quite similar across a geographically, ethnically, and sports team appreciative landscape. I know that numbers can sometimes be quite dry and sterile, but I think that it's important as we go through the day to recognize the fact that these numbers represent voices. They represent thousands of voices. And we heard one of those courageous voices this morning, and it's my hope that as we go through the day today, we'll keep hers and the thousands of voices like hers in mind as we do this work together. Thank you. Enjoy your coffee.